House lawmakers will take up the funding bill approved by the Senate tomorrow morning. It promises a later vote on the expiring ACA health care subsidies.
Yeah, it's been one of the key points of contention between both parties. Lisa Gonzalez gets the facts.
There's a lot of talk about the expiring ACA subsidies. So we went to factcheck.org to learn how this will impact you. So Democrats first passed the Expanded Affordable Care Act subsidies in 2021. It was part of pandemic relief legislation. The enhanced subsidies were set to last for 2 years, but were extended through the end of this year through other legislation passed by Democrats. Under ACA, subsidies are available for people who buy their own insurance on the marketplace and if they earn 400% above the federal poverty level. For an individual, that's $62,000 a year, $84,000 a year for a couple, and $128,000 for a family of 4. When the ACA subsidies expanded in 2021, it increased the financial help enrollees could get, and it eliminated the 400% income cap. If the subsidies expire, there would be no tax credit anymore for people who make more than 400% of the federal poverty level. So let's take a look at some examples. We went to health policy research organization KFF for the breakdown of this. They looked at the changes families could see with the expiring ACA subsidies. We also have a breakdown of this on the KCRA3 app. You can follow along on your phone as I show you these. So the premiums are based off income. Right now, people are paying up to 8.5% of their income for health insurance. If the subsidies expire, people would pay more for their premium, from 2 to 10% of their income. So for an individual who makes $35,000, you are paying 3% of your income towards your health premium. If the subsidies expire, you would pay 7.5% of your income towards insurance. That would be a $1,500 increase. Let's take a look at the changes for a family of 4. If your family takes in $90,000 a year, you would pay 5.2% of your income towards your health premium. If the subsidies expire, it would jump to 9.4%, and that would be a $3,700 increase. Prices could vary depending on age, income, family size, and location. Enrollment for health insurance through ACA has more than doubled since 2020. About 7% of the U.S. population, around 24 million people, enrolled this year, and the vast majority receives subsidies. The Congressional Budget Office estimated 4.2 million people will not have health insurance in 2034 if the enhancement expires. But they also estimate a permanent extension of these subsidies would cost nearly $350 billion over 10 years.